Hello, and welcome to the February 2022 Wendell Foster In Service. Today, we're going to be talking about workplace safety, reporting incidents, and COVID-19. Okay, so to start with, let's talk about workplace safety, and in particular, safety awareness and good workplace practices. So, according to OSHA, people that work in healthcare and social assistance industry are actually more prone to injury than in any other field. In fact, people that provide patient care are at a heightened risk of getting injured with their bones or muscles and their joints. And now this can occur through overexertion from repeated manual lifting that's often associated with patient transfers and repositioning. So back in April of 2015, the CDC actually published some information about this. And they were referring to a study that occurred between 2012 and 2014. And in particular, they focused on 2013, where 1 in 5 reported non-fatal occupational injuries occurred among workers that were in the healthcare and social assistance industry. So again, in 2013, of the injuries that were reported, 1 in 5 were among workers in healthcare. Now, this is the highest number of injuries reported for all private industries. That means that our industry certainly has some potential hazards that we must all be aware of. In fact, if we look at that data again, and they took facilities, 112 of them, and analyzed them. And these were in 19 different states. And they found that frontline healthcare workers were most likely to sustain injuries than workers in any other job. So the big question is, how can we keep our employees safe? We know that there is a risk of injuries here at Wendell Foster, but what can we do to mitigate that? Well, by going more in depth into the study, we found that all the patient handling injuries reported were when lifting equipment that was available was not used. This occurred actually 82% of the time. And so when this equipment wasn't used or wasn't used properly, people were injured. So the first thing we can do to make sure that we're safe is to actually use the equipment and the machines that we have available for us and not take any shortcuts, because all that does is provide us with an environment that's unsafe to work within. The thing is, we're not going to focus today's training on just one particular job title here at Wendell Foster and the risk associated with it. And that's because every job here that we have has some amount of risk associated with it. And that includes repetitive motion injuries, working with potentially hazardous chemicals, trip hazards, that poor posture again, working with sharp objects, not just knives, but if you do any kind of thing with food, those ninja blades are sharp, or even pocket knives or razor knives. And then you have the environmental injuries, which will be your heat and cold injuries. And then improper techniques when moving heavy objects. All of this stuff has a potential risk involved to it. So if we're really going to address how to be safe at work, we need to start at the very beginning. And that is to become safety aware. This is the very beginning of how to be safe here at Wendell Foster. Safety awareness is the recognition of the hazards that we have here. And not just recognizing that we have hazards, but it's also showing a willingness to act to control the hazards that are present. Simply put, it means that we all must not just be aware of the hazards, but to take ownership of our workplace to ensure that it remains safe, not just for me, but for you and our other coworkers. So if you see something, correct it on the spot or report it so it can be corrected with the right person. So let's review some more common hazards over the next few slides. And I'm going to try to move through this very quickly so I don't bore you to death. But here we have some hazards. This could be heavy items placed on half shelves, icy walkways, wet floors, or even chemicals are improperly stored. I'm sure a lot of people are tired of hearing me talk about chemicals, but chemicals are improperly stored can leak and cause some issues. And then we have other injuries or other hazards such as sharp knives and blades, and then hot surfaces, needle sticks, Stepping on and off vehicles. That's a real hazard for people working transportation because those vehicles are fairly tall and sometimes you're not aware exactly where you are in relation to the entry or exit of that vehicle. You also have biohazards. Anybody that works in direct care or in laundry are at risk of biohazards, and we must treat those properly. And then you have these wet bathroom floors. The bathroom floors get very wet in both SCL and in the ICF. And in fact, even in physical therapy, those pool area bathrooms can get very wet too. So what we need to do is be aware of the wet floors and try to mitigate that risk by making sure that everybody else is aware of it and clean it up. Okay, so let's talk about some things we can do to prevent accidents and injuries. And this is all very common, easy stuff. The first thing, stretch your muscles before you start your shift, during your shift, and then after your shift. Throughout the day, whether you're sitting down all day or you're engaging in a repetitive motion, you need to take a moment to do something different. Get up, walk around, stretch your muscles, and then get back to work. Doing so can help prevent long-term injuries or muscle sprains. You also want to pay attention to what's called your ergonomics at your workstation. Now, we're going to talk more about ergonomics in a few minutes, so I'm not going to go too in depth with this. But simply put, ergonomics is setting up your workstation where it makes sense for you. In other words, you want to make sure that everything's within arm reach, so you don't have to overreach or stretch for something. You want to make sure your computer monitor is level with your eyesight, so you're not looking up nor down. You also want to make sure that your chair is comfortable and you're sitting in the right position to where your feet are flat on the ground. Also, during the day, you need to take frequent breaks away from your desk or your work area. This is great for clearing your mind, walking around, refreshing yourself, or just simply resting. But take a few minutes throughout the day to take a break, to rest, refresh yourself, and so you can get back to work without injuries or illnesses. Also, shortcuts are like the bane of our existence here at Wendell Foster. Shortcuts have a lot of risk involved in it. But we take shortcuts because we're very busy and we feel like we don't have time to do things the right way. When in fact, we do have time. We do have time to do things the right way. What we don't have time for is for people to get unnecessarily hurt or injured because they were taking shortcuts. So make sure that we do the right process and the right procedures when performing a task so we can prevent injuries. And finally, you hear me talk about PPEs all the time, but they're very important. There are some activities or tasks that we engage in that we need to wear PPEs, but you may not because you have this false sense of confidence. Maybe you've done this 100 times and I've never had anything splash on me before. Well, when you don't wear your PPEs, you're increasing the risk level. And just because something didn't happen the 100 times before doesn't mean it's not going to happen the 101st time. So wear your PPEs to prevent accidents and injuries and to keep yourself safe. And then we can also communicate with our co-workers when a hazard exists. And one of the best ways to do this is by using signs. So let's say that there's something wet on the floor. When you go try to clean it up, it's still going to leave the floor a little bit damp, which is still a hazard for slippage. So what we can do is communicate with our co-workers by just putting a wet floor sign there over that spot or near that spot to alert them of the hidden danger. That way they're aware of it and we have a safe workplace. So use your wet floor signs when you have the opportunity to. It can maybe save somebody from a horrific injury. Another thing we need to do is to refrain from texting while we're walking. And I am really bad about this. So feel free to call me out when you see me. But there is a hidden risk to texting and walking at the same time. And that is, it's very hard sometimes to concentrate on just one task, let alone multiple things at once. So the danger here is that you may be so focused on that phone and the communication taking place that you're completely oblivious to any trip hazards or objects you might run into, or even worse, oblivious to a vehicle that may be driving towards you. So let's put the phone down and get to our destination or get to a safe place and then shoot off that text message. And finally, asking for help when we need it. But let's be honest about this. Most of us don't. And there are various reasons for it, but a lot of people do not ask for help when they need it. So let's embrace that and come about this a little differently. Instead of waiting for someone to ask us for assistance in performing a task, how about we volunteer to help them the moment we recognize they may need our help? That way, we're offering our services to them early, we're giving them all the assistance they need, and they don't have to ask for help. It's not the right way to do things. Take ownership of where we work, see the task for what it is, jump in, help out, and get it done. And we also need to keep all walkways and exits clear of obstructions. We don't want to block access to handrails with furniture or boxes, because if somebody's in need of that exit and they have trouble seeing, the handrail can actually guide them to the exit. And all entrances and exits should have a clear and direct path. If anything is placed in the middle of that path, if there was a fire or somebody has an urgent need to get out, that could actually slow them down or cause an obstruction for them. And finally, when it snows, we need to walk on a path that has been cleared already by our maintenance or our contractors. And in addition to that, parking lots are very dangerous, because a lot of times we pull into a space and the parking lot has been partially cleared, except for that spot that's right under our car. And so when we get out and we put our foot down, there's a very big risk of actually slipping on a patch of ice. So when you're getting out of your car, look down first to see where you're putting your foot to make sure it's safe. And again, in doing so, we can hopefully prevent any slips, trips, and falls. Okay, so now we're going to talk about ergonomics. And I mentioned this a few minutes ago. But basically, we're going to talk about how to interact safely and efficiently within your work environment. So the short definition for ergonomics is that it's the science of fitting the job to the worker. And here are some examples of poor ergonomic practices. It includes exerting excessive force onto an object, repetitive motion, having an awkward posture, a static posture, which means you're staying in position for way too long, and using awkward tools or handles, and where like the tools or the handles don't really fit you. So I love using this picture because we can all relate to this. And this is an ideal example of somebody taking on way too much all at once. By using ergonomics the right way, an employee can minimize their risk for injury on the job. It involves both setting the work environment up to ensure the employee has less stress on their body and thinking responsibly. And one of the best ways we can practice thinking responsibly is by just stating to ourselves, just because I can do something doesn't mean I should. Such as the guy in this picture here. Just because he can carry all that doesn't mean he should carry all that. Being responsible at work means that you're going to work smart. You're going to ask help from others when you need it, and you're also going to help your co-workers when it appears they require it. And so here we see some common ergonomic injuries. And so we have chronic back pain, carpal tunnel syndrome, eye strain, joint injuries, tendinitis, rotary cuff injuries, tennis elbow, trigger finger, and then muscle sprain and strains. Preventing ergonomic injuries isn't that difficult. It can be as simple as positioning your monitor at eye level, reduce any glare from your monitor or windows, use support for your wrist and joints as needed, and when position tubs and beds at your ideal height when helping somebody. Keep all objects within arm's reach that you use quite frequently to reduce overreaching, and when sitting in a chair, keep your feet flat on the ground. And the final component of safety awareness is to make sure window Foster stays in good repair. And what I mean by this is, if you see something that is broken, needs to be fixed, go ahead and report it to maintenance. You can have your supervisor fill out a work order, or if it's after hours or on the weekends and it's an emergency, you can call the maintenance after hours phone number at 270-903-5378. If you see something that is a safety risk, go ahead and alert your supervisor and make them aware of it so we can do the right thing and put some fixes in place. Keeping window Foster safe isn't just one person's responsibility. This is a task that belongs to all of us. So another thing we need to talk about today is how to report incidents. And with incidents, I'm referring to anything that is a work-related injury or some unusual circumstance that might have happened. So there are two types of incident reports that we use here at Wendell Foster. The first being the employee incident report. And this is where we document any type of employee injury, illness, property damage, or anything else that may fall under this topic. The second is the general incident report. Now this covers things such as finding drugs on a property, if we have to call the fire department or ambulance or the law enforcement to Wendell Foster, any acts of vandalism, anything that is stolen property-wise that's more than $100 in value, an incident with a visitor, domestic disputes, all this stuff will fall under general incident report. Policy E4 states that any work-related injury, illness, or occupational disease exposure must be reported to the employee supervisor as soon as possible. Some things to remember with this is that you should never wait more than 24 hours to report any type of incident or injury. You also should make sure that your supervisor completes their portion of the employee incident report. And finally, once you complete this report, make sure you turn this into Human Resources within 24 hours of the report of injury. For on-site employees, a nurse on duty will be responsible for making sure that that injured employee and service recipients are evaluated and that they receive any necessary medical attention. Now, the nurse will also be making the determination whether or not outside medical treatment is necessary at that time. Now, if the employee requires emergency medical treatment, the nurse on duty should send the employee to One Health at work when it's during normal working hours. Now, if it's during off hours, the employee should be sent to the emergency room of Owensboro Regional Health Systems. When completing your paperwork, please make sure that you're as thorough as possible. Include all those key details are included when answering the who, what, when, where, and the why. So here's a quick example of what an employee incident report looks like. And I'm only going to show you just briefly what you need to fill out on here. And so we start at the very beginning, of course, the date and the location of where the event happened. And then this section right here, you're merely just talking about who did this occur with, what department did they belong to, what's their job title. And to the right, we have the information about the supervisor and the date and the time of the incident itself. And if we scroll down, we're going to indicate, was this an injury, illness, property damage, or other. We're going to have to talk about all this stuff. So we're just indicating here what type of incident was this, and we'll explain in detail later on what exactly happened. And then as we go further down, we're going to talk about the persons that may have been involved, any witnesses that may have been present, because perhaps we can get more information from the witness. And then we have the activity that's being conducted at the time of the incident itself. Now what we have here is just merely what exactly happened with this incident. We want to know in detail with as much information as possible. And in fact, as we scroll down here, we're going to indicate what body parts were injured. We use the picture and we can write out a description if we need to. And the employee is just going to print, sign their name, and put a date on it. Now below that, we have a section that the employee will not fill out. That's actually the nursing assessment, unless the employee is declining treatment, and then they can sign right here where I have it highlighted along with the date itself. Now this last section here is what's going to be completed by the supervisor or whoever's doing the investigation. But we have here what corrective actions need to be taken to prevent this from happening again, who will be responsible for it, along with the date of what's required for the completion itself. And then we have below that any other notes or comments that are relevant to the actual incident. Finally, when we turn this into HR, we'll have a date that when it was received and the initials of who actually received it. And then everything else below will be completed by the supervisor and vice president of that department. And here we have a general incident form. This is what it looks like. And so when we zoom in, we can see it in more detail. At the very top, we have a place for your name, your date, the department and time of incident. We want to know all the details so we can. So it's just about drugs on property, a fire department or an ambulance being called here, anything of this type we're going to indicate. We want to know the specifics of where did this incident occur and the actual event in detail. And then if a police report was filed, And if yes, please attach a copy of that form and then the signature and date of the person completing this. And then below that, we have all the information for the supervisors and for the departmental vice president to complete. If you have any questions on how to complete an incident report or how to file it, please don't hesitate to contact your supervisor, or Human Resources will be happy to help you. Okay, I have a quick reminder for everybody. If you're an hourly employee and you use their app on your phone, please remember that you're only supposed to access this when you're not on the clock. All work-related activities, to include trainings and meetings, are to be performed when you actually clocked in for work. That way you get paid for it. And now we're going to talk about COVID-19 vaccinations and policies. Now, the COVID-19 vaccination is required of eligible staff at healthcare agencies that participate in the Medicare and Medicaid programs. Now, here at Wendell Foster, this is going to include departments under the ICF. This is your residential, your nursing, recreation, dietary, and behavioral services. This also covers any other department under outpatient services, laundry, housekeeping and maintenance, inventory, and residential clothing. Eligible staff must submit proof of their second dose of the COVID-19 vaccine by March 15, 2022. And if you receive a COVID-19 booster, please turn in your updated vaccination card to Human Resources as soon as possible. Now, once you get the COVID-19 vaccine, you're still going to need to submit to signs and symptoms daily checks at the beginning of your workday. Now, even if you have the COVID-19 vaccine, if you're showing symptoms, we're still going to need to test you for COVID-19. And if you work in the ICF and there was an outbreak and you're in the outbreak area, you'll need to be tested too. But don't worry, we're about to cover all of that in detail. Now, to find out where to get the COVID-19 vaccine, all you need to do is search for www.vaccines.gov. It will bring up a search bar where you can search by zip code. Go ahead and enter that in, and you'll find local places such as Owensboro Health Regional Hospital, Walmart, Walgreens, and Myers. They'll pop up in your search screen. The best way to do this is to call in advance and make an appointment. If you try just to show up to get the shot, you may run into some difficulties or be waiting for an extremely long amount of time. Okay, so now we're going to talk about COVID-19 exposure guidelines. Bear with me, this is very detailed, so I'm going to try to make this as clear as possible. So, if you are somebody who has received the COVID-19 booster and you've been exposed one time and you are not living with somebody who's tested positive, don't worry, because testing is recommended but not required. And if you're not showing any signs or symptoms, you have no work restrictions. If you are vaccinated and you have a one-time exposure and you're not living with somebody who is tested positive, well then you should be tested immediately and then again 5 to 7 days later. If you're not showing any symptoms, you do not have any work restrictions. If you're not vaccinated and you have a one-time exposure, you're not living with somebody who's tested positive. And in that case, you should be tested immediately and then again 5 to 7 days later. And if you're not showing symptoms, you will not have any work restrictions. Now, if you're unvaccinated and you do have a one-time exposure, which means you're not living with somebody who's tested positive, but you've been exposed one time by somebody, well, in that case, you should be tested immediately and then 5 to 7 days later. Also, if you're not showing signs and symptoms, you do not have work restrictions. If you've received the COVID-19 booster and you have a continued exposure incident, which means you're living with somebody who has tested positive for COVID-19 and you're not showing any symptoms, you do not have any work restrictions. But you must test immediately and 5 to 7 days later. You also need to stop working if you do become symptomatic and wear a well-fitting mask for 10 days after the exposure. If you're vaccinated and have a continued exposure incident, which means you're living with somebody who has tested positive for COVID-19 and you're not showing symptoms, you don't have work restrictions. Now, you should be tested immediately and then again 5 to 7 days after the exposure. You also need to stop working if you start showing symptoms and wear a well-fitting mask for 10 days after the exposure. Now, if you're unvaccinated and you have a continued exposure event, which means you're living with somebody who has tested positive for COVID-19, you're unable to work. In fact, you need to quarantine with that positive person through the duration of their quarantine. And you also must test the day after the quarantine ends to see if you test positive for COVID-19. You can return to work if the test is negative and no symptoms are present. You also must test again 5 to 7 days after the quarantine ends and wear a well-fitting mask for 10 days after exposure. At any time in this process, if you test positive for COVID-19, please notify HR as soon as possible. If you test positive for COVID-19, regardless of your vaccination status, discontinue working immediately. You need to return to work 5 days from the onset of symptoms or positive results, whichever is first, assuming that you are fever-free for 24 hours. You also must wear a well-fitting mask for an additional 5 days after the infection. For more information on the COVID-19 vaccine, you can visit vaccine.ky.gov.
Every vaccination brings us closer to getting out with our friends again.
Closer to another hug with Mum.
To doing things we always loved.
To getting back to a match with my son.
Closer to life feeling normal again.
The COVID-19 vaccines have had the same safety checks as any other vaccine and will help protect you and the people close to you. Getting vaccinated and following the public health advice is our best way out of this.
Every vaccination
brings us
Closer
Together.
And now I bring you Wendell Foster News and Events. Congratulations, Charlie Fowler, on winning our Valentine's Day door decorating contest. The next time you see Charlie, please tell him congratulations. Not only did he win this contest, but his door will now be featured in the Wendell Foster monthly newsletter. And let's not forget everybody else who signed up for this event and the staff that helped them. Everybody did an amazing job by the details and design and creativity they put into their project. So everybody give them a round of applause and congratulations again, Charlie Fowler. And here's a special shout out to the Action Club. The Action Club recently participated in Random Acts of Kindness Day all over town. During this event, cookies were given to the Pant Manny, donuts were passed out, and chores were performed for a neighbor. The Action Club demonstrates what it takes to be a difference maker in the community. Good job, Action Club. The Wendell Foster Golf Scramble is back. Plan for a fun day out on the golf course with us on Friday, September 16th, 2022. Registration begins at 7:30 a.m. with tee-off at 8:15 a.m. and this will be at Ben Hall's golf course. There will be prizes, lunch, and goodie bags included with the team registration. We'll see you there. Join Wendell Foster on Saturday, June 4th at 5:30 p.m. for the 2022 Annual Benefit Dinner and Auction to celebrate 75 years. Enjoy a great evening, including a silent live auction, dinner, and entertainment. Auction items include rare bourbon, curated travel experiences, sports mementos, and tickets to popular attractions. And wait a minute, did I mention there'll be bourbon there? Doors open at 5:30 p.m. with the program beginning at 6 o'clock p.m. For this event, we will need a lot of volunteers, so if you're willing to help us out for this, please don't hesitate to contact Sarah Poole at spoole@wendellfoster.org. On Thursday, July 21st, 2022, from 10:30 a.m. to 1 o'clock p.m., Wendell Foster will be hosting the First Responders Barbecue. And that's on this day that Wendell Foster recognizes the Owensboro and Davis County first responders. So please join us for this event so we can all thank them for the work they do for Wendell Foster in our community. This is for local and active first responders. Lunch is on us in the Wendell Foster Century Park. Did you know that this year, Wendell Foster is celebrating its 75th year as a difference maker? And throughout this time, we have grown from a dream to reality and touched the lives of many. Every day, we have the privilege of making a difference in people's lives in the world we live in. So to all the difference makers, past and present, thank you for being Wendell Foster. At this time, I want to thank you for your time and your patience in reviewing this material and to remind you to please complete and turn in your in-service test. Also, don't forget to write your name at the top, make sure it's very legible, and put today's date. Thank you.